are some of the things surrounding man that most of us ignore. But some professionals have gone beyond to utilize herbals by saving life and protecting the environment. In our EcoPlus program today, we are privileged to host the executive chairman of Jena Herbals Limited, that's Dr. Ogwang. Most of you must have heard of him during the period of COVID.
My name is Professor Ogwang Patrick Engeo. I used to be called Dr. Malaria because I developed Herbal for malaria prevention. I've done 14 years without malaria. Many people have done so without malaria. These days they call me Professor COVID-X, Professor COVID-19, because of the COVID-X which we developed to cure COVID-19. I work also with Mbari University of Science and Technology as Associate Professor of Pharmacy in the Department of Pharmacy, where I head the Department of Pharmacy. I'm the head of the Department of Pharmacy there. And I'm also the executive chairman of Herbals Limited, a company that developed COVID-X and produced it for Ugandans and Africa and the world. And also we have 15 other products that we develop and manufacture for treating and curing different diseases, including ulcers, high blood pressure, diabetes, cough. You must have heard about Jena cough, which is now a leading product in Uganda and about to cross to Kenya and Congo and other countries. And I'm a married person with children, and I come from Teso originally. That's where I was born. My dad is from Teso, my mother is from Lango, and I'm a Ugandan. I studied in Makerere for all my 3 degrees. I never went to Harvard. I studied in Uganda. So I'm proud that with our knowledge and our skills, we can develop solutions that can help Ugandans and Africans and even Europeans. So to me, that makes me happy that we can also provide the world with solutions.
Professor Ogwang explains the various categories of herbal medicine.
Yeah, now I always tell people that there are 2 kinds of, what I would say 3 kinds of herbal medicines according to WHO categorization. Okay, 4. The first one is category 1. Category 1 is where the person who is a herbalist in the village or in a community goes and picks the plant, comes and maybe boils it or mixes something and gives the patient directly. That's category 1. Those medicines are normally safe because the person making it, you know her or you know him. The village knows them. The community herbalists or health workers, they are known and they have experience over years that learned about medicine. So most likely, and most times their medicine is safe and does what they say it does. Category 2 is where somebody now makes it into like a commercial form and packs it. Like now maybe you go, you find people moving with the kazindalo, they call it kazindalo, on trucks. That category 2, the person who is on kazindalo selling it is not the herbalist who had the original knowledge. So that category 2 may not be safe unless tested. So this medicine which they are moving with in bags, in trucks, may not be safe because the person now who is selling it does not even know original formula or has not even had experience with it. Category 3 is where it is research based, like in a research institution, maybe like Mbara University has developed a product, or Natural Chemistry in Rwanda has developed a product, or an industry like Jen has developed a product as a research product. That one, because of the scientific data, you can be sure that what is safe. Then category 4 is where the product has gone through clinical trials. Category 4, clinically tried and proven to be safe. Now, of those 4 categories, category 1, I said it's okay. If a herbalist giving medicine, I know that grandmother in the village, I trust her, people know her, I can take her medicine without fearing. Category 2, this person moving around with it in his bag or in his car, I will not buy that one because I'm not sure of who made it and there's no scientific evidence. Category 3 of research I can take. Category 4 for a commercial company, I can take. So in terms of safety, I wouldn't worry about the herbalist in the village I wouldn't worry about the research institution. I would not worry about a company like Jenna, but these ones who are hawking, I would worry.
After having done research for 17 years, Professor Ogwang was able to conceptualize and come up with Covidex as a cure for COVID-19 pandemic.
Almost all medicines come from nature. Whether it is the coartem, it is from a plant. Whether it is quinine, it is from a plant. Whether it is the digoxin for treating heart disease, it is from plants. So medicines come from plants, from animals, from nature. The scientists may modify the structure of the chemical, but the original molecule is from nature. Now, since childhood, I have been interacting with nature. My mother, I always refer to her, she used to make for us medicines from plants. Medicine for stomach ache, medicine for malaria, medicine for cough, were from plants. So when I joined the university to study pharmacy, I began doing research to understand our own plants and the medicine that our mothers used to use. Because I knew that medicines come from those plants. So for about from 2004 to 2021, I have been studying some plants in Uganda here. And I'd got to know that those plants have antiviral properties. They kill viruses, including measles virus, including HIV virus.
He tells us the plants used in making Covidex solution.
Covidex, we put 3 plants. One is called Xanthoxylum gilleti or chalibium. One of those species works. The botanical scientific name is called Xanthoxylum gilleti or chalibium. There are different species in Uganda. That's one of the plants we use. As I said, in Unyankole it's called Mutatembwa. In Ateso it's called Ewusuk. In Luganda, in Tale, Ledungwe, or whatever it is. And then the second plant is Wabuga ugandensis. The botanical name is Wabuga ugandensis. In Western Uganda, they call it Omwiha. In Luganda, I think they call it Nkubeza Nume. Our place, we call it Abach. So those are the 2 main plants. Plus Symphophobon citratus. Symphophobon citratus is chisubi, lemongrass. Yeah, those are the 3 plants we use in Covidex.
Professor Ogwang explains what a molecule is and a virus.
A molecule is a structure that has a chemical formula, and on its own, it is sufficient to do some reactions, either chemical reactions or physiological reaction in the body. So a drug is a molecule because it has the chemical structure. It has a structure like I would call it a molecule because it's a complete unit and you can operate. So I would call it a molecule. But now in terms of chemistry or biology, we call them molecules. We refer to chemicals that are an entity that is complete but that can produce an effect, like a drug effect. That's a molecule. Now a virus is a particle or one of the smallest microorganisms, the smallest thing that you cannot see with your physical eye, but under aided eye, like a microscope, you can see them. They are those microorganisms that cause diseases in people. Some cause disease, some don't cause disease. So that's what a virus is. Now it's made of units. We call them like nucleic acid units. Those are like the different components of it. Yeah. So a virus is the smallest microorganism we know so far that has capacity to integrate into a human body, either the cell or any other part of the body, and multiply itself using the machinery of the body. Like HIV virus, it enters your body and multiplies itself using your own proteins and your own other cell organelles or cell components. And because when it multiplies, it can affect you and make you sick. Yeah. Because COVID-19 was killing many people, the Chinese, the Americans, the Europeans, it was known that Africans are going to die like flies. But since there was no cure, it gave us chance to wake up and say that since now the people who normally give us medicines don't have the solution, we are not going to sit here and die. So with my fellow scientists in Bar University, we began to what we call literature review, reviewing data on different plants that are in Africa, especially in Uganda, to know which of those plants could work for COVID-19. So initially our plan was to come up with the original formula developed from the lab to tackle the disease. But because there was no time, we had now to look into what products we have been having individually as an institution, which we can use quickly against this disease. Now, among the products that are developed under my company, there were 3 products that we knew had plants that have antiviral properties. But the one that was very promising was Covidex. So in 2020, I began to do more work on that product. But we never had enough funds to do the scientific work. But in 2021, we got support from government. By then, it was called Means of Science, Technology, and Innovations under Dr. Elioda. So when we got that money, it was now easy for us to begin laboratory tests on that formula called Covidex. And we're using the machines in Barra University where I was working with other students of mine. And during that time when we were testing it, COVID began killing people. And 2 of my staff, a professor from America who came to Barra University to do work, he had COVID-19 and he was really dying. He was dying, that's the fact, in the hospital. So one time I went in the morning to meet him. I told him that, Professor, there is this formula. We are sure it kills viruses and is safe. But we have not yet tried it on what? On any COVID patient. But since you are really not doing well, you take this medicine. It may help you, but at least I'm sure it will not harm you. We need to be safe. So he accepted to take it. And within 2 days, he called me saying that he's very okay. And they're going to test him. If he's negative, he's going to be discharged on Saturday. Just within 2 days. And indeed, on Saturday, he called me that, Professor, thank you very much. I've gone to Mayanja Memorial Hospital. They have checked me. I don't have COVID-19. Also, my lungs, which are getting spoiled, are now okay. I'm going to be discharged today. And he was discharged. Then his friend, who was a lecturer in my department, with whom they shared the same vehicle when they are moving, also had COVID-19. And he had been at home because he was a bit young. He wasn't badly off, but he was treating from home. But he was also not okay. When he heard that the other professor had recovered, he also called me and said, I've heard that you have treated, Professor. Can you also give me something? I gave him the treatment. And within 2 days, his test was also what? Negative. That was around December 2020. Now, so we now put more effort to test this medicine, because if you say that you have a cure for COVID-19, at that time, you were a candidate for prison, because the Europeans have failed. Who are you, a Ugandan, say that you can cure COVID-19? So we needed evidence, laboratory evidence, to support the clinical evidence we are seeing. But as we were testing COVID-19, in 2021 around April, many COVID cases began calling me. Those who knew me. Actually, at Mbara University, in the Department of Pharmacy, we had the medicine there. Staff of Mbara University can testify that anyone who had COVID was coming there in April, May. We were already using it in April, May, before we informed the Ugandans. And nobody in Mbara University staff died of COVID-19. Because we began using it early, April, May, we were already using it. By the time I informed the public in June, I had treated over 30 people with COVID-19 in Mbara University. My staff, my friends, and their relatives. So the concept of Covidex came because of 17 years of research on our plants, understanding that those plants can kill viruses, knowing that COVID-19 is a virus that attacks your throat first and affects your lungs, and having the scientific data we had in the laboratory, and people were willing to take the medicine when they are badly off.
At the time when the world had lost hope due to the massive numbers of deaths resulting from COVID-19, Professor Ogwang says it was miraculous for his medicine to have become a cure for COVID-19.
By the fact that my own colleague, the professor, was dying and I saved his life, I was very happy. Very happy because he's my good friend. I encouraged him to come to Uganda and help Ugandans as a volunteer. Now he had COVID-19 and was dying. If he had died, honestly, I would have felt very bad as a person. But also the burden of transporting his body to the US and all these things was going to be bad. So when I saw him recover, I was really very happy, very happy. And I thanked God very much for using me that time to save his life. And then there are people who were really badly off with COVID-19 at that time. You know, someone will call you and they are coughing. They are coughing and they're saying that they are going to die. Someone says, me and my wife and my daughter, we are sick and we are going to die. Help us. And I give them the confidence, and then tomorrow they call me saying that, oh, we are breathing well, we are okay. For me, really, it was a time of joy. It was a difficult time because people were really suffering. There was lockdown. There was cloud over the country. We are all going to die. So suddenly God gives us a solution, and we see people recovering. It was a miraculous time, I should say. Personally, as a person, I was very happy despite the stress I was getting. And up to now, I meet people. Last week I was in Barara, and an old man walked to me and said, I want to thank you. He gave me 5,000 shillings. He said, I saved his life from COVID-19. Yes, I was very happy to receive the 5,000 because he said I saved his life from COVID-19. So there are many of such. Wherever I go, northern Uganda, eastern, as long as I know this Professor Gwang, somebody comes and says that, thank you for what you did. I would not be alive if it was not for that medicine. So I think as a country, we are also happy. Many Ugandans are happy. At a time when we thought that we were going to die, something came up.
Asked on how he felt after government considered supporting him in his research, this is what he answered.
It was a breakthrough because I think that when it was now approved by National Authority, the demand went up. That became a problem again for two reasons. One, we could not produce enough because the demand went up. We had the medicine, but we didn't have enough bottles. So it had to take the intervention of State House, the president, to make sure that we get bottles from Kenya. Otherwise, the potable bottles were sabotaging us, I think. So if you are not called Kenyan government to open up the supply, we are going to fail to save many lives. So I thank the president for that also, and State House. And also, when the demand went up, people also began increasing the price. They say demand determines the price, but I was not happy with that. Because one of the things that was in my heart, nobody should die because of COVID-19, because they can't afford. So for us at the factory, we were first selling at 3,000, then we increased to 5,000. And we maintained it at 5,000. I think the most was like 6,000. So I knew that someone can't fail to get 10,000. But people were selling it, of course, 30,000, 50,000, 100. In Rwanda, I'm told it was $100. In South Africa, it was $300. People were just putting their price. But as a person, I wanted every Ugandan to afford it. So to some extent, there is evidence that when government approved COVID in July, COVID deaths went down. There is evidence for that. People died mainly in May and early June. But by the time we released COVID deaths went down. So I'm grateful to the government that they approved the products that are now produced in hospitals, in the clinics, and people now could use it with confidence. That helped many people to what? To be saved from dying.
Prescription of herbal medicine is good if sourced from the right source, as Professor Ogwang elaborates.
So for me, Ugandans now are putting more thought that these plants are useful and these herbs can help us. And especially government is now very supportive of research in herbal medicine and developing these products. And I'm told that the government has made a directive that if there's any product that works, clinically proven, government must buy it and put in our hospital. And that's a very good move. Because one, it gives us alternatives. Personally, I don't like using modern medicine. I like using herbal medicines because evidently and scientifically they are safer. And sometimes they work better for some diseases, much better than what? The European medicine. Secondly, we make them from our own plants here. It means that we are not exporting our money. We are retaining our money in the economy. We grow the plants here, extract here, make the capsules here, and we use them, and even export them to other countries. So for me, this area of our medicine is good for our economy, good for our health, and also for general sustainability of Africa.
Local herbs are very important as they beautify our environment and save life.
They make the place green. We are here surrounded by herbs, different trees. Herb is from the word plant. The Greek word phyto means a plant, and also herb is from a herb or plant means a plant. So herbal is from herb, and herbs are plants. So plants make the environment beautiful. We're in a beautiful green environment. That's one thing. Number two, these herbs are plants. They give us oxygen. They give us rain. They help control wind. So really, plants do a lot, not just medicine. And that's why at Herbals Limited, we are growing these plants. If you come to Soroti, we are growing these plants. We have Wabugia, they are growing. We have Enteledumu, they are growing. We have other different plants we are growing because we get medicine, but also they help with the climate, they help with the make environment good. So we must encourage plants to be grown for environmental purpose, but also for medicinal purpose and food purposes. Yeah. Like right now, as our demand is increasing and herbal medicine is gaining ground, we are realizing that now what the farmers are growing may not be enough. For example, there's a plant called Artemisia annua. Right now, we're the ones who used to, you see at first,
It's called what in
Artemisia annua. I think in the photo they called Akerukana. So at first, it was brought for making medicine for malaria. So they made farmers to grow it and they would buy it and ship it to, I think, India. Then they make quite a amount of it. But when the Indians began growing their own, they stopped buying from those farmers of Kabale. I'm the one who did research on Artemisia annua in 2008, 2009, 2011, 2012 to find better use for that plant. And I'm the one who used to buy from those farmers of Kabale and Fort Poto. But now, companies have learned about the plant. The demand for it is now high. So my company can no longer get from Kabale. But I am happy that we pioneered product development in those plants locally. Now the demand for farmers has increased and farmers now can earn money out of it. At first they're just throwing it, they are pouring it. And that's the value of local research to develop local products that can utilize the raw materials. So the challenge, yes, as the industry grows, raw materials are going to be scarce. So we need to encourage people to strategically begin growing some of those plants. Like now, Artemisia, we need farmers for Artemisia because Kazira is buying, Chituzi is buying, who is buying. So we need people to grow it. Yeah.
Professor Ogwang tells us one of his memorable moments in the journey of research.
First, Ugandans have been doing research on the local herbs. From when Makerere began, maybe 1940s. If you go to medical school Makerere, if you go to Mbarara Medical School, if you go now to maybe Busitema or Gulu, people are doing research on local medicine. But there has been a missing link. Research for papers, research for certificate, for masters, for PhD. I get my certificate. I work on the streets, proud that I'm a graduate of Makerere University. What did you work on? I did research on Entale Dungu. I must do my research to apply to develop a medicine that can help people, which is very important now. So many scientists now are learning the value of converting that thesis or dissertation into a product. And I think research should be like that. Application of what you researched on, very important, not just to store in the library. For the viewers, I want to say herbal medicines are good. That's for fact. I am a scientist, I'm a professor, I use herbal medicine myself for myself and for my children. What's important is that they are well studied, well standardized, well packaged, and properly prescribed, and we can get benefit out of it. So I want to encourage Ugandans to use especially like our products from Herbals Limited. They are well studied, and almost 90% of them are effective. You get results. But also, I want to thank the government and the president and the ministers and all institutions that now are supporting local innovations. That's very important. If Uganda is to develop, we need to support local research and local innovations that we shall develop as a country. So we need more support to government and also support to scientists and other entrepreneurs.
Scientists don't undermine herbalists, as they also save lives in their own way. Repeating the words of a professor may dilute them, but this has been Professor Patrick Ogwang of Jena Herbal Limited. Thank you so much for watching UBC TV. I've been Mary Chakwa for EcoPlus program.